Okay, so today's topic is regarding plantar fascia tears. If you have heel or arch pain, you might not just have plantar fasciitis, and you might actually have a tear or a rupture of the fascia. So the plantar fascia, if you look at the foot model here, is a ligament that originates in the heel and fans into the toes. So a lot of times when people have certain foot structures where they roll in as they walk, we call that pronation, or even people who have high arched feet that cause them to put excess strain on the heel, they may develop inflammation of the ligament, which we call plantar fasciitis. So plantar fasciitis can also occur from a tight calf muscle, and that's why when you stand up from a seated position or when you stand up early in the morning, you might experience heel pain or arch pain. The problem is when you get repetitive stress or strain along the plantar fascia over time, like say you started a new exercise regimen where you were trying to increase your activities a little bit too soon, sooner than you should, while you were running or even walking, you can place additional stress on the ligament on the bottom of the foot. Or if you're training for a marathon, you might notice significant pain on the bottom of the foot. So what happens is that the plantar fascia, even though it's strong, it can tear, resulting in a plantar fascia tear. Now, what's different from a tear is a plantar fascia rupture. Plantar fascia rupture can happen if you step down wrong on your foot, like in an abrupt manner, like say you're getting off of like a truck or something and you come down hard on your foot, the actual ligament can rupture and that can cause significant pain. So plantar fascia tears can be difficult for people to differentiate between just plantar fasciitis, and one of the things that you need to know is the symptoms and how they differ from plantar fasciitis in general. So with plantar fasciitis, a lot of the symptoms that people experience is dull and achy pain, although sometimes the nerve pain can be present too, causing sharp pain in the heel. But plantar fascia tears, the pain is a little bit more intense, and that dull, achy pain and that soreness kind of sticks around for several weeks and just doesn't get better. One of the other things you'll notice with plantar fascial tears is that you might notice a little bit of swelling in the heel or along the arch in the area of the tear that you might not notice so much if you have just plantar fasciitis. You might also notice some bruising. When the plantar fascia is ruptured, meaning like an extensive tear, you might notice significant bruising, and you might even be able to feel the rupture too on the bottom of your foot. You know, you'll kind of feel like a little delve or a divot in the area. Plantar fascial tears can make it super hard to walk and continue your activities, and that pain just kind of lingers and causes a lot of discomfort when you're standing and also when you're at rest. If you have a true plantar fascial rupture, you might even hear a popping sensation in the bottom of your foot in the arch area or the heel area. So in regards to diagnosing plantar fascia tears, make sure you go and see your foot doctor if you have pain in your heel or your arch area that's constant and just kind of lingering and not going away. One of the things that your doctor will do is they'll actually feel the different parts of your foot to see if there's an area that has pinpoint tenderness and to see if they can even feel the plantar fascia being torn. They'll also order x-rays to rule out things like stress fractures and bone tumors and things like that that can also cause heel pain. Now, the plantar fascia is not visible on x-ray in detail, so they're not getting the x-ray for that, but it's important to rule out all of the other causes of heel and arch pain. If your doctor suspects that you have a plantar fascia tear, they might recommend that you get an MRI, and what the MRI will allow is to visualize the entire plantar fascia to see if it's just inflamed inflamed or if there's a tear present or even a rupture. Sometimes an ultrasound can be ordered of the foot, which can also identify a plantar fascia tear, but the MRI is a bit more detailed and a bit more sensitive. The MRI will also rule out other causes of heel pain and arch pain like a stress fracture. So let's talk about what you should do if you think that you have a plantar fascia tear. First of all, don't do any activities like excess walking or running that might be aggravating the condition. Make sure you listen to your body. If something is hurting, don't continue to do it or else the pain will worsen. Also, make sure to ice the heel or the arch wherever you're having the pain. Ice actually constricts the blood vessels and helps to reduce pain. So make sure you're doing that intermittently for 10 to 20 minutes at a time. Also, if there's swelling in the heel, you can also elevate your foot. Make sure to use some pillows to elevate your leg to help reduce that throbbing sensation. If you're able to, you can also take an over-the-counter anti-inflammatory like Motrin or even Tylenol to help control some of the pain. As far as treatments that your doctor will recommend for plantar fascial tears, if you are found to have a plantar fascia tear or rupture, your doctor will recommend that you walk in a cast boot for about 6 or so weeks until the tear is able to heal and improve. A cast boot can easily be obtained from Amazon, but you can get a prescription for a cast boot and go to a medical equipment store near you that a doctor recommends so that hopefully your insurance will cover it. The cast boot is basically a removable cast that keeps your ankle and your foot straight and alleviates strain away from the bottom of the foot and disperses the pressure. So it kind of forces your foot and ankle to rest and to hopefully alleviate some of that pain that you experience from that plantar fascia tear or rupture. During this time, you'll still have to ice and elevate your foot too to help control the symptoms. One of the other things that your doctor will suggest once you've worn the cast boot and the plantar fascia tear has started to heal itself is arch supports. So when you wear arch supports, orthotics help to lift up the feet and to disperse stress away from the plantar fascia when you're walking. So arch supports are great when you're in the recovery process of trying to get your plantar fascia rupture or tear healed because it'll help alleviate strain. Custom orthotics are the best option. That's when your doctor will take a mold of your feet and make custom orthotics that are designed for your feet. The problem with custom inserts is that they're usually pretty pricey because they're custom made and they generally last about 5 to 10 years depending on how much you wear them in your shoes. The price of custom orthotics can vary depending on which clinic you go to and the materials they use, and they could cost $400 to $800. If you're not wanting to get custom orthotics, then trying an over-the-counter orthotic can help as well. I like the PowerStep brand because the PowerStep orthotics have a pretty good arch support in them with a deep heel cup, and they're durable and they work well. There's different kinds of PowerStep orthotics for different foot structures, so make sure you talk to your foot doctor about recommendations. For very flat feet, I like the PowerStep Max orthotics. It has a little bit of a heel wedge on the bottom of the orthotic, which kind of helps with that excess pronation. And if you have moderate flat feet, pretty neutral feet, you can actually get the PowerStep Pinnacle orthotics, and those orthotics are supportive and they work well. And for people who have high arched feet, I would get the PowerStep Pinnacle High Arch inserts. I'll attach a link in the description so that you guys know what to get. You can get it directly from powerstep.com or Amazon. Now, for plantar fascial tears and ruptures, we don't actually inject steroid into the area. In fact, in rare cases, if multiple steroid injections are administered into the heel, that can actually lead to a plantar fascia tear. So we like to stay away from steroid injections if possible, and usually have patients stay in the boot followed by inserts until it heals. Plantar fascia tears and ruptures, especially if they're bad ones, can take up to 3 months to heal. Your doctor will modify your activities according to how it's healing. There are some rare cases though when the plantar fascia tear just doesn't heal or the rupture is significant where your doctor may recommend surgery. Basically, under sedation, an incision will be made on the bottom of the heel, and the plantar fascia will just be transected completely so that it's released and thus provides pain relief. Also, scar tissue might be removed in the area as well, and you're looking at about 6 to 8 weeks off of your feet after surgery until the surgical site heals. But again, that's for more rare cases. Now, a lot of people ask, if you have a plantar fascial tear, can you still walk? And the short answer is yes, you can still walk, but again, make sure to listen to your body and don't overdo it, or else you can make the tear worse. To see more videos just like this one, make sure you guys subscribe to the channel.